Please follow these instructions as closely as possible to help avoid any complications. Your pet received general anesthesia during surgery. This can make dogs a little clumsy and unsteady on their feet. Supervise them at all times, especially around stairs. Anesthesia can make cats a little crabby. Don't immediately put your fingers in their carrier. When you get home, open the carrier in a quiet, dark space and let them come to you when they're ready. They may want to be alone for the first few hours, and that's totally normal. After 24 hours, animals should be back to their normal selves. Lethargy lasting more than 24 hours after surgery, diarrhea, or vomiting are not normal. Please email us if this happens. If our clinic is closed, take them to your regular veterinarian. Do your best to keep your animals calm, quiet, and separate from other animals in the house for the next 7 to 10 days. No running, jumping, playing, swimming, bathing, or strenuous activity. We know this is difficult. We ask that you make every effort to not excite or encourage roughhousing, as it can cause the surgical incision to stretch, which could cause it to open. If you have kids at home, please make sure that they're gentle and careful as your animal has just had surgery. This rule goes for anyone interacting with them over the next 7 to 10 days. We recommend supervision over the next 7 to 10 days, but we understand that life happens and you may have to leave your pets alone for periods of time. If so, we recommend placing them in a more confined space like a bathroom or bedroom to help limit their activity and the possibility of an injury. Dog crates are also a great option. Dogs can go outside for short walks on a leash to use the bathroom. Once they're done, they should be brought back inside. If they use pee pads, they can continue to use those. Indoor cats can continue to use the same litter and the same litter box that they're used to. There's no need to change anything. Cats that are indoor-outdoor must remain indoors for the next 7 to 10 days to help keep their incision clean and dry during the healing period. All female dogs and cats have been given a small green tattoo next to their incision to indicate that they've been spayed. The tattoo is a small green line in the skin and is not an extra incision. This is done to prevent her from being opened up again by a doctor in the event that she gets lost and someone brings her to be spayed. All sutures dissolve on their own over the next month or so. There's no need to return for suture removal. When you get home from surgery, you can offer your animal food and water, but they may not have an appetite. This is another side effect of anesthesia. Appetites usually return to normal after 24 hours. Please do not change their diet for the next 7 to 10 days. Only feed your pets what they're used to. No table scraps, milk, or any other food for people. Diarrhea and vomiting during the healing process are not normal, and if that happens, we want to know it's from the surgery and not from a change in their diet. Look at your animal's incision when you get home. What you see today is the worst it should look. Please check their incision twice a day. It should look a little better each day as it heals. There should be no additional swelling or discharge. Males may look like they're still intact. The tissue has been disrupted, so there may be swelling, but we assure you that the doctor has done their job. Think of what you're seeing as a change purse. The change has been removed, but the empty sac will still be there. Any swelling should go down over the next couple of weeks. If swelling has not reduced over the next couple of weeks or gets bigger, please email us. If you have any questions or concerns, please email us right away at spay@dakinhumane.org. It helps us if you include a picture of the area you're concerned about. Email is the fastest way to reach us. If the doctor feels like they need to see your pet for a recheck exam, we'll coordinate a time with you. There's no charge for a doctor to recheck an incision. If there's an emergency after hours, call your regular veterinarian or the closest emergency veterinary hospital to you. The medical paperwork we sent you home with will include phone numbers to the closest emergency veterinary hospitals: VESH, West Springfield, New England Veterinary Center and Cancer Care in Windsor, Connecticut, VESH, South Deerfield. Your animal is capable of licking their incision open. Male dogs over 40 pounds tend to be the biggest lickers. For that reason, we highly recommend having a lampshade collar on hand. These can be purchased at Dakin or at most pet stores. For cats, we recommend waiting until you see licking at the incision area before putting a cone collar on. They can cause severe stress, which makes the healing process more difficult for them. If you do see licking at any time, a cone collar needs to be placed on the animal right away. If they lick the incision open, that could be a trip to the emergency room that can easily cost $3,000. Dogs will go home with liquid pain medication to be given by mouth. Cats have been given a long-lasting pain medication injection since it's more difficult to give oral medication to cats at home. The injected pain medication to keep them comfortable will stay in their system for 72 hours. We recommend a recheck with your animal's regular veterinarian 2 to 4 weeks after surgery. This is not required, but it's important to establish a relationship with a full-service veterinarian. Your full-service vet will be able to tell you if booster vaccines will be needed based on your pet's age and if they were up to date on shots at the time of their surgery. It's important that you hold on to the medical record we gave you when your animal was discharged from surgery. Bring it to any vet visit over the next 30 days so your veterinarian can see what was administered under our care. That way, they won't give your animal anything that might react negatively to what we gave them. Thank you for trusting Dakin with the care of your animal companion during their surgery. Open the description box below this video for a list of more programs and services for pets and people at Dakin.